Every summer, people walk into a clinic and show me a small red mark on their skin. A ring, slightly raised at the edges, spreading outward like a target. They point to it and say the same thing, almost without exception. I think something bit me. It should clear up on its own. And then they wait. I am Dr. Hiroshi Nakamura. I have practiced internal medicine and geriatric health for more than 30 years, and I have watched that decision to wait cause damage that takes months, sometimes years, to undo. Lyme disease is not a rash. The rash is simply the moment the door opens. What walks through that door, if you do not close it in time, is something far more serious and far more difficult to treat. I want to explain to you today exactly what is happening inside the body when a tick bites you, what the signs actually look like, why so many people miss them, and what you need to do before the window of easy treatment closes. This is especially important for anyone over 50, because in an older body, the consequences of a delayed diagnosis are more severe and more lasting than most people realize. Stay with me for a moment, because the first misunderstanding about Lyme disease is the one that causes the most harm. Most people believe that if a tick bites you, you will know it. You will feel it, pull it off, watch a rash form, and understand what is happening. This belief is almost completely wrong, and it is worth understanding why. The tick responsible for transmitting Lyme disease in most cases is a species called the deer tick, known in medicine as Ixodes scapularis in North America and Ixodes ricinus in Europe and parts of Asia. In its most dangerous stage, it is a nymph, which means it is smaller than a sesame seed. It does not hurt when it attaches. It does not itch in any way that feels unusual. Many people spend time outdoors, return home, shower, and never notice it at all. The tick feeds for anywhere from 36 to 72 hours before the bacteria it carries, a spiral-shaped organism called Borrelia burgdorferi, transfers in sufficient quantity to cause infection. This is a critical window. If the tick is found and removed within 36 hours of attachment, the risk of transmission drops dramatically. But most people do not find it, because they were not looking. This is the first thing I want you to take seriously. After any time spent outdoors in warm months, a walk through tall grass, a hike through wooded areas, gardening, sitting near hedges or leaf piles, check your entire body. This is not a suggestion. It is the most effective single action you can take. Now let us talk about the rash, because this is where the second misunderstanding lives, and it is a costly one. The rash associated with Lyme disease is called erythema migrans. It begins at the site of the bite, typically appearing somewhere between 3 days and 30 days after the tick detaches. In its most recognized form, it is circular, with a pale center and a reddened outer ring, giving it the appearance of a target. This is the image shown in textbooks, on health posters, in awareness campaigns. The problem is that this classic target pattern appears in fewer than half of all Lyme rashes. In the other cases, the rash may be uniformly red, oval rather than circular, warm to the touch, and with no clear center ring at all. In people with darker skin, it may appear as a bruise-like discoloration rather than a classic red mark. It may appear in a location you cannot easily see: the back of the knee, the hairline, behind the ear, between the shoulder blades, the inner thigh, the groin. And here is the part that people frequently dismiss. The rash does not usually itch. It does not usually hurt. It simply sits there, quiet, expanding slowly over days. And if it is in a location you cannot easily see, it can expand for 2 weeks without your knowledge. If you notice a rash like this anywhere on your body in the summer months, after any outdoor activity, even if it does not itch, even if you do not remember being bitten, contact your doctor. Do not wait to see if it spreads. Do not apply cream and monitor it yourself. Do not decide it is probably an insect bite of no consequence. The rash is your clearest early signal, and once it fades, which it will, on its own, within several weeks, it takes the signal with it. What remains behind it is not nothing. If this sounds familiar to you, if you have seen a rash like this on yourself or someone in your family and dismissed it, write yes in the comments below. I want to understand how many people watching this have been in that position. I want to tell you about a patient named Walter. He came to me at the age of 67, referred by a neurologist. Walter had been an active man throughout his life, retired from a career in forestry, spent most of his summers outdoors. He was not a person who complained about physical symptoms. His wife had noticed that over the previous several months he had become forgetful, in a way that was different from his usual self. He was losing words mid-sentence. He had developed an irregular heartbeat that had been attributed to age. He had a persistent tiredness that did not improve with sleep. His knees ached in a way that moved from one to the other without clear cause. When I reviewed his history carefully and asked about the previous summer, he recalled a rash on his lower back. Oval, red, appeared in July, faded after a few weeks. He had assumed it was a reaction to his shirt fabric or insect bites from working near a water source. He had not seen a doctor about it. By the time I was speaking with him, more than 9 months had passed. His blood tests confirmed late-stage disseminated Lyme disease. The bacteria had spread beyond the skin. It had reached his nervous system, which is called neuroborreliosis. It had affected his heart's electrical conduction system. It had settled into his joints. He underwent a course of intravenous antibiotics for 4 weeks, followed by oral treatment. His heart rhythm stabilized. Some of his neurological symptoms improved, but his fatigue and joint pain remained significant for more than a year after treatment. He recovered, but not fully, and not quickly. Walter's case is not rare. It is the pattern I have seen more than once, and the gap between what happened to him and what could have happened, a brief course of oral antibiotics in July, full recovery within weeks, is the gap that early recognition closes. I want you to understand what happens inside the body when Borrelia burgdorferi moves beyond the skin, because understanding the mechanism is what makes the urgency real rather than abstract. In the first stage, the bacteria remain near the site of the bite. The immune system responds, the rash forms, and if antibiotics are given at this point, the response is excellent. The organism is stopped before it can spread. In the second stage, which typically begins weeks after an untreated infection, the bacteria enter the bloodstream and travel. They have a particular affinity for several tissues. The nervous system is one of them. Facial palsy, where one side of the face drops and does not move correctly, is one of the more recognizable signs of nervous system involvement. Shooting pains, numbness, weakness in the limbs, difficulty with memory and concentration, these are less dramatic but often more lasting. The heart is another target. Lyme carditis, the inflammation of heart tissue caused by this infection, can disrupt the electrical signals that coordinate the heartbeat. In a person over 60, whose heart may already be managing some degree of existing strain, this additional burden is not trivial. The joints are the third major target. Lyme arthritis tends to affect large joints, particularly the knees. It can cause significant swelling and pain that comes and goes, moving between joints in a way that makes it confusing to diagnose without specific blood tests. And in the third stage, months to years after the original infection, some patients develop persistent symptoms that continue even after antibiotic treatment. This is sometimes called post-treatment Lyme disease syndrome. The exact mechanism is debated, but the experience of patients who live with it is not. Fatigue that does not lift, cognitive difficulty that does not fully resolve, pain that continues without obvious cause. This is not inevitable, but it becomes more likely with each month that passes between infection and treatment. This is what I want you to understand most clearly. The bacteria do not wait, they move, and the longer they move without interruption, the more ground they cover, and the more difficult that ground becomes to reclaim. Now let me give you something practical, because knowledge without action is not useful. First, know the tick-check routine and use it every time you return from outdoor activity in warm months. Run your hands through your hair and along your scalp. Check the back of the neck, behind the ears, the armpits, the inner arms, the area around the waist, behind the knees, between the toes, and the groin. Ask someone to check your back and the backs of your thighs. This takes 3 minutes. It is the most effective prevention available. Second, if you find an attached tick, remove it carefully with fine-tipped tweezers. Grasp it as close to the skin surface as possible and pull upward with steady, even pressure. Do not twist. Do not crush the body of the tick. Do not apply heat or petroleum products to make it detach. After removal, clean the area with rubbing alcohol or soap and water. Note the date. Third, monitor yourself for 30 days after a known tick bite. If any rash appears, regardless of whether it matches the classic target pattern, contact your doctor and mention the tick bite. If you develop fever, fatigue, muscle aches, or joint pain in the weeks following a tick bite, even without a visible rash, tell your doctor and ask specifically about Lyme disease. Fourth, when spending time outdoors, wear light-colored clothing so ticks are easier to spot. Tuck trousers into socks when walking through grass or wooded areas. Use insect repellent containing DEET on exposed skin and permethrin on clothing. These are not complicated measures. They are consistent ones, and consistency here is what makes the difference. The body has a remarkable capacity to recover from Lyme disease when it is caught early. I have seen patients treated within the first weeks of infection return to full health without lasting difficulty. The disease at that stage is genuinely manageable. A short course of oral doxycycline or amoxicillin, taken for 2 to 3 weeks, clears the infection in the vast majority of cases. What I want you to take from this conversation is not fear. I want you to take awareness. Summer is a time most people associate with outdoor activity, with nature, with movement, all of which are genuinely good for the body, particularly after 60. I am not suggesting you avoid the outdoors. I am suggesting you pay attention to what comes back with you. A small rash that appears after outdoor time is not automatically nothing. A mild fever in the weeks following a hike is not automatically nothing. These signals deserve a phone call to your doctor, a specific question, and if necessary, a simple blood test. That is the entire ask. If this was useful to you, please subscribe to this channel. I will continue sharing what I observe in my patients, not to cause alarm, but to give you the information you need to make decisions earlier, while the options are still straightforward. Leave a comment below. Tell me whether Lyme disease is common in the area where you live. I read every comment, and it helps me understand where this information is most needed.